We start by listening to the patient, listening to their story. This often reveals certain clues about what's going on. After that, we'd obviously want to examine the patient, and that would normally start with a kind of holistic kind of look at everything really from their feet up to their head, looking at the overall posture. We will want to look at how their spine itself is moving, so looking at them bending in different directions, seeing what directions are comfortable, what directions aren't comfortable. We also need to assess passively, which is basically meaning feeding ourselves the individual movements in the individual levels of the spine, see which segments are working well, which ones are moving well, which are stiffer, which aren't working as well. In addition to that, we will also do the standard kind of orthopaedic or neurological test, testing people's reflexes, looking for signs of pinched nerves, that sort of thing. And we'd also want to get a good feel of the muscles in the spine, so seeing whether there's tight, taut bands of muscle, which could be a sign of cause of the pain, or even a reason for certain parts of the spine being overly stiff, or even the opposite. And also, lastly but not least, would be making sure their core muscles, so looking to assess whether or not their core muscles are working and are supporting the spine in the right way. If we needed to get more information on a patient, then I think the single most valuable investigations to have done, and I think most spinal consultants would agree with this, would be an MRI scan. With an MRI scan, you can see all the structures you're interested in. You can see the bones, the muscles, the ligaments, the discs, the joints, the nerves, even the fat and the fluid around the nerves. So you can see precisely what's injured, what isn't injured, and not only that, you can see to what extent it is injured. So for example, a patient who we suspected of having a bulging disc or even a torn disc, we'd actually see how bad that was, and that would then lead on to the prognosis and the treatment planning, whether it's something that we are likely to be able to help with, or whether it's so bad that really they've got to go and get a surgical opinion or try some injections first. Thankfully, most of the time that's not the case, and the vast majority of patients we are able to help, and only a very relatively few would need to go on to have those surgical opinions. But the MRI scans really are invaluable in that respect.
Thank you for watching this video all the way through. For effective treatment and advice for muscle and joint problems throughout the body at either of our clinics in Chigwell or Woodford, call us at SpinePlus to book an appointment on 0208 501 0937. You may like to know that we've made several other videos with information and self-help tips on specific problems, everything from tension headaches to heel pain. Some of our suggested videos are shown below, or you can search our playlist to discover more. We'd also be really grateful if you could like and share any videos you watch, and please subscribe to our channel by clicking on the subscribe button to be kept informed of our latest information. For more information on our clinics, click Find Out More to be directed to our website.